vaccines is a lightning rod that even some folks in the MAHA movement actually don't want vaccines to go away. These are a lot of moms, a lot of people who have children with medical needs, and need them to have vaccines. And so there is definitely a lightning in a bottle here on that issue, no doubt. And RFK is doing, I think, very dangerous things for this country.
I'm Kimberly Atkins Stohr, and this is Justice by Design, where we talk to people who are finding real solutions to the problems we face as a society and who also help you figure out what part you can play in those solutions. Now, here on this podcast and also on my other podcast, #Sisters-in-Law, I spend a lot of time talking about what the U.S. Supreme Court does wrong. Well, today, here's a twist. We're going to be talking in part about a decision that the Supreme Court got very right. And they got it right because they upheld the ACA's really crucial component that helps protect preventative care. Yes, the ACA has been under attack with challenges for over a decade, ever since it was passed by Congress and signed into law by President Obama. But it still survives, and that's good news. But still, preventative healthcare is something that isn't as accessible to everyone as it should be. And that's what I want to talk about today. And that's why I'm so happy to be joined by Natalie Davis, who is CEO and co-founder of United States of Care. Natalie, thank you so much for joining me.
Thank you so much for having me. I'm happy to be here. And like you said, happy to share some good news that's coming out of the Supreme Court.
That's really right. So I always ask my guests to kick things off, to introduce themselves to our listeners a little bit. Tell us a little bit about who you are and what you do there at United States of Care.
Great. So as you said, I'm Natalie Davis. I'm a co-founder and CEO of United States of Care. I'm a mother of 4 and live in Washington, D.C., though coming to you right now from a cabin in Minnesota. And United States of Care is an amazing organization. We are an advocacy organization that works at the state level and in the federal level to make sure that healthcare is more affordable and accessible for all people. And what makes us really unique is that we do that by going out and talking to people across the country. So we've engaged over 30,000 people, over 5,000 hours of talking to everyday people across demographics, about what they want out of the healthcare system, what they love, what they hate, language they use, solutions they believe would help make the healthcare work better for them, and really looking for those shared beliefs, those shared needs, the shared language, et cetera. So we can use that to show to policymakers, look, people across demographics want you to fix this, and helping them then get the policies across the line. And that's why this court case, like you mentioned, Braidwood versus Kennedy was just so important for our organization to work on, and why we're so pleased that the Supreme Court ruled in the right way.
Yes. So before we get to Braidwood v. Kennedy, I want to talk a little bit more about this work that you're doing, because I found it really interesting. I know a lot of times when I report on healthcare issues, or even when I talk to my own doctors, frankly, I'm often told that one of the biggest problems is a lack of data, a lack of, whether it was data during the pandemic and how it was tracked so that we could learn more about the coronavirus as it was spreading, or data about gaps in healthcare access, or how healthcare is different among different demographics. Yeah. Often that is lacking. And I just think that this is such a brilliantly simple approach that you're taking when trying to figure out what Americans across the board need from healthcare, is you are simply asking them, which you would think is something that would have been done before. But tell us a little bit more about that, how you came to that approach and how you've been able to implement that and what you've learned.
Well, I love the way you put it. It is like quite so simple and yet kind of groundbreaking. When we started the organization, I was coming out of working on the Obama administration, building out healthcare.gov and other aspects of the Affordable Care Act.
Let's just pause for a minute. You just had a little simple job of helping build out healthcare.gov. That's
and then
a crucial component.
so many other amazing federal employees that do amazing work every single day. And, that was a complete highlight of my career and really made me realize as we went out and talked to people across the country after the passage and, right in the years afterwards, that, like many of us heard, if you took away the political lens of it, if you took away the name of it, if you said, this is what healthcare can be for you and better coverage, et cetera. People across demographics were into it for the most part. And there was a real easy way to politicize it. And, as we thought about after that and then after the first Trump administration, when we started this organization, we really wanted to prove there was a different way of thinking about solutions and thinking about healthcare. And we had this belief that people agree on more than they disagree, that in politics hide that. And I actually, not being an expert in any other field, I would love to take this approach to education and climate and others, because I think there's just something so human about it. And so when we were starting the organization, we had to prove this theory. And so I looked to human-centered design and how often that's used in other products that we have in our life, and thought, why can't we have human-centered policy design? And so really looked to set out a different way of talking about, and even my board then and others were like, okay, Natalie, yeah, you're going to go talk to people. Okay. And then what? But years later, and it is simple at times. We start every conversation. It's now led by Dr. Venice Haynes, who has a PhD in community engagement. And since the beginning, we ask people the same 5 questions. And not only are they great groundbreaking icebreakers, but it's really been fun to track those over time and find the themes. And one of the first question we ask is, what's the first word that comes to mind when you hear the word healthcare? And for the most part, almost every single answer has to do with price, cost, unaffordable, greed, not in it for me, profit driven.
Wow.
And so, that making healthcare more affordable continues to be one of the cornerstones of our advocacy work, because it is the biggest concern people have. And whether they can't afford it, if they can afford it, they worry they can't. And if they can't, then they forego care. And so, it's been really important for us to maintain an ability to go out and talk to people authentically. We talk about it. It's not just about lipstick on a pig and we've got an idea and we just need people to agree with it on a poll. It's really about going out and understanding those shared values and shared needs. And we call it listening loudly then to populations that are left out of the healthcare community, left out of the conversations, left out of solutions. And so we, over listen or listen loudly to people of color, people in rural America, and people with low incomes, just to really make sure that we understand where it's failing the most, what would work the best for people. And so last thing I'll say is we have a robust methodology that's anywhere from ethnographic research, where we're in communities talking to people at libraries, or in rural South Carolina, rural Maine, to all the way to then a little bit more scientific focus groups and polling. And that mix, it becomes really, really rich data on so many topics within healthcare.
Well, this is really great. You're already anticipating a lot of questions that I have for you that I will return to in that opening, but that made it a really, really perfect opening. So I want to talk about this Supreme Court opinion. Now, I'm not going to make you talk about, the appropriations clause, or the appointments clause. Sorry, the appointments clause. That's what the case was actually about, a kind of arcane constitutional issue about the structure of the Affordable Care Act. But the practical terms that I want to talk about and that our listeners can relate to is that there is a board that is in place to advise about preventative care and approve certain preventative care that will be authorized by the Affordable Care Act to be provided at no cost to people. And this was the latest of the challenges to the Affordable Care Act. It was a challenge that was brought by employers, how do I say this, conservative Christian employers who objected to things like PrEP, the preventative medicine that prevents the transmission of HIV, a very crucial medication, from being covered for their employees. This is one of the latest conservative challenges to the ACA. We've seen them challenge access to contraception as preventative care and other things. But the Supreme Court found that no, this task force was constitutional in the way that it was set up and in the way that it was run. So that's really all you need to know about the appointments clause
Yeah.
for this discussion. But that win was an important one, as is the fact that even this very conservative Supreme Court has time and time again turned away challenges that are aimed to gut or strike down entirely the Affordable Care Act. I know that your organization was among those who submitted a friend of the court brief in this case. So tell us a little bit about how you saw the stakes in this case and what this outcome means.
Yeah, and you set it up. No surprise, you set it up so well. This really was questioning free preventive services that 151 million Americans rely on, 23 million children. And basically, if you're listening and you have insurance through your job, this was looking to take away those free preventive services that all of us have come to rely on and sometimes don't even realize are happening or that they used to not be free. This is anywhere from colorectal cancer screening, breast cancer screening, skin cancer. There's just numerous amounts. And this would have said that they weren't required to be free for all of us. And so it really is important that they upheld this and saw that not only is this important to allow this HHS, the Health and Human Services Secretary, to utilize this expert, independent, scientifically based task force, like you said, but that it really was, the law was written in a way that it is true, it is accurate, it is upheld that those can then be required for insurers to cover for free for people.
Yeah, and it's really important to point out that I think a lot of the coverage mentioned PrEP and mentioned some of the communities, including the LGBTQ community, that could be deeply impacted by that. I know a lot of advocacy groups were very vocal about what the implications of this case could have been if the Supreme Court ruled in a different way. But it really is for all of us. I mean, I remember particularly in the early days of the ACA, but even still now, I remember hearing from friends of mine, for example, we were, be talking about something, a hormone treatment that was needed, like the pill or something, and people were like, it's really expensive. And I'm like, no, no, no. This is something that is considered preventative care. If your pharmacy is charging you for this, you should talk to your insurance provider because that should not be the case. That should be provided to you
Right.
at no cost. And I felt not just as a journalist, but as somebody who signed up on the exchange because I had an employer that could not provide me. My employer was based in a different state.
Yeah.
And couldn't include me on their plan. So they told me to sign up on the exchange. So I was an expert in how people actually were interfacing with the ACA, how they were getting their care. And sometimes things would fall through the cracks. So the point that you made about people not even knowing that these things should be provided, or my mom, some of her medications that she needed, and she was getting these big bills. And I was like, no, Mom, that's preventative. That should be covered entirely. So then you have on top of that, people are still challenging this, but I want to get back to how this is everyone's problem because it's really easy to put this aside and say, okay, well, people who need PrEP can get it. But this was an attack that could have affected all of us.
Yeah. I mean, think about when you go to the doctor and you don't even realize that they're giving you free tobacco cessation screening and advice, preeclampsia screening for women that are pregnant. Right. Like you said, all the screenings from breast cancer to prostate colon cancer. And then if you think about the medical debt in this country, that is just astronomical and horrible. Talk about another Supreme Court case that went the wrong way, but that GoFundMe is now the place you first go to when you have a diagnosis. When we think about people not getting these screenings because of if they had to pay for it, they wouldn't get the screenings, and they would show up to the healthcare system sicker. We know that 1/3 of Black adults suffer from medical debt compared to only 13% of white adults. And so any amount of cost sharing is going to make people sicker, not go to the doctor, increase medical debt. And that really does impact all of us.
Yeah, it has a big effect. I remember I had an appendectomy in law school before the ACA,
Yeah.
and I had a $4,000 bill that, as a law student, I couldn't possibly pay. My parents helped me, but
Yeah.
that was really, I mean, I had appendicitis. Like, what was I supposed to do? But that's one of the reasons I was very grateful for the ACA. So I want to talk about what this means. So it means that this task force that was a part of the ACA remains in place. But I'm sure people listening have a lot of other questions because that task force is a part of the Department of Health and Human Services. And currently, the Secretary of Health and Human Services, Robert F. Kennedy Jr., has a lot of, I'll put it this way, ideas about healthcare that I disagree with vehemently. And perhaps a lot of our listeners do too. There's probably a lot of fear. Because if you have a task force that's filled with people who don't believe in good preventative healthcare or who are not making good decisions about what preventative healthcare should be covered by the ACA, that's scary too. What do you say to those folks, including me, who are worried about that?
Yeah, I mean, it is something we need to watch really carefully. In the decision that the Supreme Court made, not only did they say that this task force is legal, but they did answer some outstanding questions of, well, who do they answer to, basically, or is the secretary? What role does the secretary have in these recommendations that this expert body is making, who aren't employed by the federal government, who aren't, certified or by Congress? What are, and what are the checks and balances there of this role of the secretary? And so they did clarify that the secretary does have more oversight than had previously been clarified. And like you said, that is something to really be watching for under this current secretary, especially as we know the changes that he's made to a different body that's working on vaccines, the ACIP, who were, all let go and replaced with other folks who I think have
Right.
Critical views of vaccines. And so this
Right.
is something we need to watch carefully. I'm really, really hopeful that the secretary who says he believes in making America healthy again will recognize that screening for cancer and for free and allowing people to do that is really key to keeping people healthy. And, it is something that we need to watch carefully for.
Yeah. So you mentioned vaccines, and this case was not involving vaccines. But for you, somebody who has been in the healthcare, preventative healthcare arena for a very, very long time, and this is a time where people are increasingly worried about vaccine, including me. I've written a lot about it, about vaccine access to, whether it is for measles, as we've seen with the outbreaks in Texas and elsewhere, to viruses like COVID and even the flu. The flu. I mean, I got to tell you, I mentioned it before. My listeners are probably tired of me talking about it, but last season's flu, and I had a flu shot, was devastating. It was devastating to just about everybody I know who got it. I wasn't sure my mother would survive it. She did, thank God. But if we have another season like that, I can't imagine what it would have been like if that vaccine wasn't available. So to listeners who wonder what can be done to help bring awareness and try to ensure that there is the kind of preventative care that we need, what can they do? What should they be doing now?
I think it's really interesting that I truly know and believe that there are people that are skeptical of vaccines, and so I'm not discounting that. I
Sure.
do believe that it is a vocal minority. And I do, I've actually been finding it very fascinating to listen to interviews of people who believe in MAHA, Make America Healthy Again,
Mhm.
and following that kind of coalition of the people who everybody believes is the last mile voters who got Trump elected because they had Kennedy and the real focus on health. And so I think it's really important for folks who believe in preventive services, who believe in vaccines, to be vocal. And it doesn't have to be, I don't even know if it has to be in a combative way of saying other people are wrong, but we do need a swell of people who are like, I believe in it. I got it. Here's my sticker. Like, just to combat the idea that everybody doesn't believe in vaccines. I'm hopeful that, like, right now screenings are less even political than vaccines, and so hopefully
Yeah,
these continue to stay
I
just as
think
they are and
so.
under the radar and not politicized. Um, and in watching the MAHA kind of coalitions, even within the coalition of voters, vaccines is a lightning rod that even some folks in the MAHA movement actually don't want vaccines to go away. These are a
Yeah.
lot of moms, a lot of people who have children with medical needs, and need them to have vaccines. And so there is definitely a lightning in a bottle here on that issue, no doubt. And RFK is doing, I think, very dangerous things for this country. And I'm hopeful that we can keep in mind and keep being very vocal about people who just believe in them and need them and want them, so that they do stay there and hopefully become less and less politicized.
Yeah, and I really appreciate that. I mean, to the point that you made, which I love, and which can be applied in so many arenas, which is there is more when you take politics out of it. There is more that unite us
Yeah.
than divides us. And I think even on the, like you said, the political lightning rod right now in healthcare is vaccines. But if you look, even within those who are MAGA and MAHA, if you look during the pandemic in places like Florida, where it had very, very strong support for the current president, people, particularly people over the age of 65, the uptake in
Yeah.
the COVID vaccine was in the 90 plus percentile,
Yeah.
right?
Yeah.
People were getting the vaccine. They may have, been on, protesting mask policies and stuff, but they were getting that vaccines. Like
Yeah.
they
Yeah.
wanted the vaccines to be available. And that was really heartening to me because that said, look, you can see in actual data that people wanted this, they got it, and that it was effective to help control this.
That's
So I
right.
think the more we talk to our doctors who, have a voice in this, our lawmakers,
Yeah.
people can submit comments whenever new policies are up.
Yeah.
To be considered, you can submit comments to the federal government on these. There are so many avenues for people to speak up, and it does matter. I know it often feels like people are screaming into the void. I count myself among them,
Yeah.
but there are really avenues for people to do that. So I really, I think that's so important.
Yeah, I think that's right. And I think when we think about the vaccines during COVID, we did a lot of work as an organization on understanding those hesitant groups and
Mm-hmm.
the kind of messages and education that worked. And I think it's just a great reminder of, in healthcare, we often push things out and just assume people are going to take it and they should just take our word that it's important. And
Yeah, no.
so much of what we try to say is, and like so many other people, is we need to meet communities and people where they are and have language and messages that matter, that meet their values, that help understand how this helps their specific lives. And I think that that'll continue to be, how if MAHA is going to work or whatever it is, that the next thing that's going to help us stay healthy and is really understanding how much we need to do that work to let people know why it should matter to them, because in the
Yeah.
end of the day, it's their choice on if they go to the doctor, if they get a screening, if they get a vaccine, if they and I think often when we're doing big policy changes and societal changes, we forget the importance of being right there and talking to people and understanding and bringing those concerns back to policymakers.
So I want to go back to the point that you made at the beginning when you ask people what they think of when they think
Yeah.
of healthcare, and so much of it centered around cost. I can understand that. I mean, when I signed up on the exchange because I was making 40 grand a year and I needed that. It was hard. There were times that I had to wait a long time just to see a doctor to get the preventative care that the ACA
Yeah.
provided. I often felt that I was not listened to by the providers who were under the silver plan or whatever I was under at that time. I wondered if it was because, in part, I was a woman or a Black woman, and I understand that there is data that supports that they are listened to less and their pain and discomfort is discounted
Yeah.
often. Compared to now, I have fantastic doctors. I really do. And I appreciate that. But some of them I pay out of pocket for because they're on concierge service. And I am wonderfully aware of that privilege. And I know that it's not available to everyone, even though it should be. We shouldn't have to be able to pay out of pocket for healthcare because it's so expensive. How do we get at those gaps, whether it's cost gaps or racial or demographic gaps in healthcare that exist today?
Yeah, everything, plus one to everything you said. And I think that really is the burden that healthcare and health and policymakers need to figure out. And I actually think I think there are a lot of things over the last couple of years that have shown we're at a tipping point where people are actually more fed up and mad and pissed off than
and they should be.
Yeah. And they should be. When we started listening, when I would talk to people and say, let me ask you these 5 questions, people would often say, I'm happy to talk to you, Natalie, but my situation is unique because I'm either too rich or too poor, too smart, too dumb, too healthy, too unhealthy. I personally am bad at healthcare. And I will tell you, over the last couple of years, we've seen a shift in language where people are starting to recognize that there are system failures, that it is not them alone that is why healthcare isn't working for their bodies. I think there was a cultural flashpoint that happened during the pandemic where people realized the healthcare system wasn't as reliable and set up as we thought. And there's a cultural flashpoint with the United CEO was horribly murdered, but we had people and voters from both sides of the aisle, people who believe in gun control saying, well, I don't know, maybe it was okay. And I think MAHA is another cultural flashpoint where things are shifting and people are starting to think about changes and wanting to demand those and really realizing how broken our healthcare system is. And so I think there's a moment, and we certainly at United States of Care are thinking about as we move up to the next presidential election, how do we go, but we want to go back out and talk to people and really understand how are voters thinking about what policymakers and their president should be focused on, especially in the wake of, all the changes that just happened to Medicaid. Because I think it's different. I think things are changing and people are going to be demanding maybe bigger changes and than they have before. I think what's always a little sobering is in our research when we talk to people and we say, look, do you want to burn it down or do you want, targeted changes that you can feel right now? People say, like, look, I know the healthcare system isn't working, but it's so critical and so important for me that you can't burn it down because you're not going to build it back better for me. I don't believe you. And so these targeted changes actually, we think are the right direction for policymakers. And I think we're kind of we're in a tough place right there. Not that I think we actually can burn it down and build it back because there's so
certainly
much.
At least not as quickly as we need it.
That's right. And I think it's because people really don't trust that if you do a change that you're going to have me in mind when you fix it. People hack the healthcare system and they have this doctor that they pay for in concierge and this pediatrician who's covered and they'll text them at night when the kid's sick and they're like, you can't mess with this, and so we're in a really tough spot. There are definitely policymakers across the country and we really look to states. It's why we work in states to make these changes. I mean, very specifically back to the court case that we worked on and that we were just talking about, there were states that were passing legislation to say, if you're going to offer coverage in the state, here's the floor of what you need to cover for preventive services. We work with a lot of other states who are really thinking about how to shield patients from bills from hospitals that they shouldn't be getting, to creating more affordable insurance options. And so, I grew up, I'm a federal person by training and my policy background, but I've come to really, really appreciate the freedom and work that has happened out in states to make sure that people are getting what they need, because that's where the rubber meets the road. You go home and you go to an in-district, meeting, or you field calls from your constituents and you're voted in and out. And I
That's so
think,
true.
coming back to what you said, people calling your legislator, calling your congressman, those your congresswomen, it's really important to make sure your voice is just as loud as industry or just as loud as some of the fringe groups.
That's absolutely right. And keep in mind, remember that with healthcare, it's at all levels. You have your local public health boards, you have your state lawmakers, and you have the federal, and all of them play a hand in this. Where can we find more information about the United States of Care?
Great. So you can come to unitedstatesofcare.org. It's our website, talks more about the work that we do, and you can kind of dive into our Braidwood case. Thankfully, we can kind of retire that one from at least the court case angle. But you can find information about our work on maternal health, on making healthcare more affordable. There's buttons where you can donate if you feel like you want to support our work. And then I would point you to a way to sign up for our newsletter. And I like to call it award-winning newsletter, even though we've won no awards. I think we should win awards. But actually, when people stop me in the conferences or otherwise, and they say like that newsletter coming into my inbox every 2 weeks, keeping me up to date on what's happening in healthcare, what matters to people across the country, what United States of Care is doing. It's a great little digest that can show up in your inbox. And otherwise, you can find me and many of my colleagues on LinkedIn, where we're doing a lot more of our kind of thought leadership work there.
All right. Well, you know what? I will put the link to the newsletter in our show notes, and I'll put a little trophy emoji next to it. So it is technically
Yay,
now
our first award.
Award-winning newsletter. Natalie Davis, thank you so much for joining me. I do hope to have you back at some point so that we can dig deeper in some of the specific issues, including maternal health care, which is just such an important topic in and of itself. So thank you so much for joining me on Justice by Design.
Thank you for the work you do and for having me on.
And thanks to all of you for listening to Justice by Design. Don't forget to follow us wherever you get your podcasts. Check us out on YouTube if you want to see this conversation and others that I have. And I'll be back next week with another episode of Justice by Design. I'm Kimberly Atkins Stohr.